Health of Young Children and Adolescents. We are Group 3. Our members are Evangeline, Faithlin, Jenny, Kristen, and Sandis. Please enjoy our presentation.
The importance of health. 24% of the global population consists of adolescents and young adults. They mostly make up a large share of the population in low and middle income countries rather than high-end countries. An example is 32% of the population in Nigeria consists of adolescents and young adults, while 17% in Germany consist of adolescents and young adults. Issues such as burden of diseases, sexuality, reproductive health, mental health, and road safety need to be addressed for young adults. The time an individual is a young adult is very important time in establishing behaviors because they will carry it on in the future. Behaviors being properly set will later on affect the future of these young adults by them driving safely, excessively drinking alcohol, smoking, and having healthy diets.
The applicable Sustainable Development Goals towards the health of young children and adolescents are Goal 3, Good Health and Well-Being, Goal 4, Quality Education, Goal 5, Gender Equality, Goal 10, Reduce Inequalities, and Goal 16, Peace, Justice, and Strong Institutions. Data on the health of adolescents and young adults. There are gaps in data for the health of adolescents and young adults, especially for the ages 10 to 19. The data in this chapter comes from Global Burden of Disease Study 2016, 2014 report on the health of adolescents from the World Health Organization, and the report of the Lancet Commission on Adolescent Health. Adolescence and young adulthood as transitional and critical periods. The changes that occur are biological, psychological, and social changes. Some biological changes are hormonal changes, onset of puberty. The types of psychological changes are cognitive and emotional development in the brain. The types of social changes are influences from their peers and being less dependent on their parents. The period of adolescence is longer due to puberty coming earlier, the delay of marriage, and the delay of beginning mature social roles. This table shows more in-depth information on the types of changes that occur in early adolescence, late adolescence, and young adulthood.
Key health burdens of adolescent and young adults. Among the lower income countries, the leading causes of death are communicable diseases, mainly in the earlier and older adolescents. Common diseases may include intestinal infection diseases, diarrheal diseases, tuberculosis, and lower respiratory infections, as well as AIDS and HIV. In the lower and lower middle income countries, the most important affects women's and maternal causes of death. Higher income countries are affected more in older age groups and include more of road injuries, self-harm, interpersonal violence, and certain cancers. 5 of the leading causes of DALYs by age group, sex, and globally for adolescents and young adults include skin diseases, self-harm, road injuries, migraines, depressive disorders, anxiety disorders, and personal violence, and HIV and AIDS. Links between the health of adolescents and young adults and the SDG target goals. Some include by 2030 to end the epidemic of AIDS, tuberculosis, malaria, and the neglect of tropical diseases and combat hepatitis and airborne diseases and other communicable diseases. By 2030, reduce 1/3 of premature mortality from non-communicable diseases through preventable treatment and promote health and well-being. Risk factors and social detriments. 5 of the leading risk factors for death among adolescents and young adults by age group and globally. The most common causes are unsafe water, unsafe sex, unsafe sanitation, hand washing, household pollution, alcohol use, occupational injuries, and drugs. HIV/AIDS is an important risk factor that is usually acquired through mothers. Occupational injuries is an important factor because it also affects lower and lower middle income countries with poor working conditions. Importantly, the health of some populations of adolescent and young adults is more vulnerable than others, such as those who marginalized due to their sexuality or ethnicity, those who live in rural areas, those who live in conflict or natural disaster areas, and those who are incarcerated face greater risks to their health and well-being than other adolescent and young adults do. The importance of social determinants include safe and supportive family, peers, and schools are critical for helping adolescents and young adults develop physically, mentally, and socially. The exposure to social and other media can also influence their behaviors and health. Additional risk factors between males and females which attribute to health disparities. Fewer adolescent girls are enrolled or complete secondary school, and they are consequently less informed about health issues. Young men face greater risk than women from war, interpersonal violence, and traffic accidents. In all age groups and regions, mortality rates are higher in males than females except in Africa.
Causes of deaths and DALYs among adolescents and young adults. First off, we can talk about early pregnancy and childbirth. High fertility rates within this group pose a significant threat to young women because the risk of dying from maternal causes is higher in low resource settings, particularly for women who are undernourished, who give birth at young ages, with short birth intervals, and in areas where maternal medical services are lacking. Adolescent females aged 15 to 19 years old are 1.5 times more likely to die than their male counterparts aged 15 to 19 years old in the WHO Africa area, where birth rates are high. Furthermore, about 3 million females aged 15 to 19 years old have unsafe abortions each year, with some of them resulting in maternal death. Communicable diseases. Diarrhea, lower respiratory infections, meningitis, and TB are still among the top causes of death among adolescents and young adults. In regions of sub-Saharan Africa and South Asia, TB is a leading cause of mortality among older adolescents and young adults. Mental health. There are several risk factors for mental health disorders in teenagers, beginning with genetics and the health of the mother. Having an adolescent parent, being an unplanned birth, being born after a short birth gap, and having a parent who married a blood related are some of the earliest examples. Non-communicable diseases. Adolescents and young people throughout the world are eating more sugar, salt, and saturated fat-rich meals, as well as getting insufficient physical exercises. Cigarette smoking is becoming less popular among teenagers and young adults. However, the prevalence of cigarette smoking is rising in many poor middle-income nations, as tobacco firms devote more emphasis to selling their smokes in these areas. In some contexts, the gender difference in cigarette smoking is narrowing as a growing number of women smoke. Transport injuries. Transport injuries are the third highest cause of mortality in children aged 10 to 14, the second leading cause in children aged 15 to 19, and the second leading cause in children aged 20 to 24. Every day, around 330 teenagers die, and nearly 400,000 young people under the age of 25 die as a result of a traffic accident. And lastly, violence. Interpersonal violence is the greatest cause of teenage fatality, with an estimated 180 fatalities each day. Furthermore, with the exception of sub-Saharan Africa and South Asia, interpersonal violence is one of the top 5 causes of mortality among 15 to 19-year-olds in every World Bank area. A partner's violence affects 30% of 15 to 19-year-old girls.
Economic and social consequences of health issues. Behaviors in young adults shapes their health as future grown adults. Young pregnancies can reduce chances of young girls completing school. Obesity as young adults can have an effect on the future physical exercise and healthy diets as fully grown adults. Smoking tobacco, drinking alcohol, and using illegal drugs can become tough to stop as adults as it is very addicting. Road traffic injuries can lead to long-lasting disabilities and could end fatal in losing their lives. Mental health issues usually beginning in younger adults and can have enormous social and economic costs as adults.
Case study cash transfer program for adolescent girls in Malawi. So Malawi is actually one of the poorest countries in the world and is at high risk for HIV and AIDS, typically in adolescent girls with ages ranging from 15 to 24 years old. They're especially vulnerable. This is due to the low education attainment and financial dependence on men. Considering it is a low resource setting, young girls are more susceptible to engage in transactional sex with older men in order to pay for finances. Cash transfer programs will also help reduce the risk of transactional sex as well as the risk of HIV and AIDS. So in rural Zamba district of Malawi, a randomized trial was conducted to assess the effect of a cash transfer program on HIV prevalence among young women. So around 1,000 unmarried women from ages 13 to 22 participated, and half were randomly assigned to receive conditional cash transfers with school attendance required in order to receive payments, while the other half received unconditional cash transfers. However, they did not need to attend school. The payments range around from $1 to $5. And after the 18-month program, participants of the cash transfer program had a significantly lower HIV prevalence rate of 1.2% compared to the 3.0% in the control group who got no cash transfer payment. Although the program reflected that there was no difference between a conditional or unconditional program, both outcomes can lead to reducing the risk of HIV and reduce the number of sexual encounters girls had, especially with the older men. Improving the health of adolescents and young adults in middle-income settings. So it is important for policymakers to take an approach to adolescent and young adult health that integrates interventions at the community, family, and school levels. Programs are implemented to enhance the health of adolescents and young adults, but will have to be intersectoral. There are also a number of measures that health systems can take to help address health issues among adolescents and young adults. So, early adolescents continue to fall ill and die from preventable or treatable diseases such as diarrhea, pneumonia, malaria, meningitis, and HIV/AIDS. Older adolescent girls, especially in lower income countries, face serious risk of dying from maternal causes and contracting HIV. So it is completely necessary and important to promote education of good quality and investing in water, sanitation, and hygiene. Main messages. Although institutional approaches are beneficial, it is also important to recognize that specific health programs, for example, TB or HIV, will help focus particular attention on adolescents and young adults and the risk factors for becoming infected with active TB disease or with HIV, and could also focus on measures that could be taken to reduce the specific risk for these diseases that adolescents and young adults face. The health of adolescents and young adults is essential to maintaining the progress made in child health, and it is also central to laying a solid foundation for the health of future adults.
Our discussion questions are: what are some health issues that adolescents and young adults face? The second question is: what can be done to reduce the health issues facing adolescents and young adults? And the last question is: why is it necessary to focus on the health of adolescents and young adults?